Is cannabinoid treatment for sleep apnea legal? Have you ever wondered about the legality of using cannabinoids for sleep apnea treatment? This topic is gaining attention, and it's essential to understand the current landscape. The legality of cannabinoid treatment varies depending on where you live. In the United States, for instance, medical cannabis is not widely approved for obstructive sleep apnea. However, there are some exceptions. Minnesota stands out as the first state to include obstructive sleep apnea as a qualifying condition for medical cannabis use. This is not the case everywhere, and many medical professionals remain as cautious about using cannabinoids for sleep apnea. Major sleep medicine organizations, like the American Academy of Sleep Medicine, have advised against using medical cannabis or synthetic cannabinoid extracts for treating this condition. Their concerns stem from a lack of solid evidence regarding the safety and effectiveness of these treatments. They also point out that established therapies, such as continuous positive airway pressure devices, are still the standard for managing sleep apnea. Research into cannabinoids, particularly Dronabinol, which is a synthetic form of tetrahydrocannabinol, has shown some short-term benefits in small studies. However, these studies are limited and do not provide enough information to support using Dronabinol for sleep apnea. Dronabinol is approved only for specific conditions, such as nausea from chemotherapy and appetite loss in people with AIDS, but not for sleep apnea. Other cannabinoid products have not been thoroughly studied in patients with sleep apnea. Their long-term effects on sleep quality and safety are still unknown. While some studies suggest cannabinoids may help with sleep latency and insomnia symptoms, the evidence is not strong enough to recommend them for sleep apnea treatment. The scientific community agrees that more rigorous research is needed. This research should focus on standardized cannabinoid formulations and validated outcome measures. Until then, cannabinoids cannot be widely recommended or legalized for sleep apnea treatment. In some areas, cannabinoid treatment for sleep apnea is legal under specific medical cannabis programs. However, it is not broadly approved or endorsed by medical authorities due to safety concerns and insufficient evidence. If you or someone you know is dealing with sleep apnea, it is best to relying on proven therapies and consult healthcare providers at accredited sleep centers for proper management.